Okay, so I think none of you all have understood this. See, basically, of course, it was not there in my slides, but I had explained you this. What is the principle of chemotherapy? It will kill all the fast multiplying cells, right? All the fast multiplying cells. Cancer cells are fast multiplying cells. They grow and multiply very fast, right? So it is going and killing all the cancer cells. But in the human body, there are other cells also which multiply and grow very fast, like your RBCs, WBCs, platelets, which are present and manufactured inside the bone marrow. Okay, so inside the bone marrow, every day you require RBCs, WBCs, and platelets, which are getting formed. So they multiply and grow very fast. But when a chemotherapy is given to a patient, the patient cannot, the chemotherapy cannot make out which are the cancer cells and which are the bone marrow cells. It will act on all the fast multiplying cells. So it will kill all the cancer cells which are fast multiplying, plus it will also kill the cells which are multiplying fast in the bone marrow. Those are the WBCs, RBCs, and platelets. Okay, so it kills and damages these cells, because of which you see myelosuppression or bone marrow suppression. Okay, so that is the principle, and this is how a patient suffers from bone marrow suppression when they are given any chemotherapeutic drugs. Is it clear now? Is it clear now?
Yes,
Can
it is
anyone
clear.
come and can any one of you come and explain? Any one person? Quickly, quickly.
Hello, this is
Yeah.
Mir.
Yes, Mayor. Tell me.
So, you're asking how methotrexate causes myelosuppression, right?
Yeah.
So, myelosuppression is called because bone marrow contains rapidly dividing cells,
Very good.
which mimic cancer cells. So, methotrexate affects these rapidly dividing cells of bone marrow. So
Very
that's
good.
how it suppresses bone marrow and cause myelosuppression.
So which are the far rapidly multiplying cells in the bone marrow?
WBC,
Which are the rapidly multiplying cells in bone marrow?
WBC, white blood cell,
Yes.
red blood cell, and platelets.
White blood cells, red blood cells, and
Platelets.
very good. Very good. So it's clear now?
Yes.
Very good, my dear. Very good. Good. So now can I proceed, please?
Yes, you can proceed.
Okay. I hope it's clear now. This is a very important thing that you all should understand. Okay. Similarly, like how a patient suffers from myelosuppression, patient also suffers from nausea and vomiting, which is also chemotherapy induced nausea and vomiting. Anemia is also you can say has been derived because the patient is suffering from myelosuppression. So anemia also patient can get if the patient is suffering from myelosuppression. Liver can also be damaged in some of the cases where methotrexate is given. Okay. Now how methotrexate tablets and injectable has to be stored. It has to be stored below 30 degrees Celsius. It has to be protected from light, keep out of the reach of children because these are chemotherapeutic drugs. So they have to be kept away from all this children in your house. Now, coming to the presentation, how is the packing of methotrexate, that is MTEX? MTEX 2.5 mg tablet is a pack of 10 tablets. Okay, in one strip, you have 10 tablets, and MTEX 50 is basically the injectable vial. This is a vial of 2 ml, and each ml contains 25 milligrams. Therefore, in one vial, the actual dose is 50 mg in 2 ml. Okay, it's a 2 ml vial. Each ml contains 25 milligram. Therefore, the total concentration becomes 50 mg in 2 ml, which is nothing but 25 mg per ml. Okay, so you have just two strengths. One is 2.5 mg tablet. You have just two pack. One is 2.5 mg tablet and the other one is MTX 50, which is 50 mg in 2 ml. So all the dose calculation and everything will be on the basis of these two types of packs only. What is the route of administration? It can be given intramuscularly, that means administered into the muscles. It can be given intravenously, so within it has to be given into the veins. It can be given intrathecally, so it can be given in the spinal cord so that it reaches the cerebrospinal fluid. Okay, so this is an added advantage. All the companies don't have all the three route of administrations. Most of the companies have got intramuscular and intravenous. All of them don't mention intrathecal use. The advantage of intrathecal use is, of course, it can be given in the spinal cords. It can cross the blood-brain barrier, so it can be used for all the types of CNS tumors. Also, plus why it can be given intrathecally, because our methotrexate is preservative free. Since it is preservative free, it can be given intrathecally also. So that's an added advantage of Khandelwal's methotrexate. Okay, and since it is preservative free, it is a single dose vial. If a drug has got preservative, then it becomes a multi-dose vial. You can use the quantity and keep it in the fridge and reuse the remaining solution. Okay, but since it is preservative free, you cannot use it for the second time. The dilution is done with 0.9% sodium chloride. So this is how the pack looks like. You have got a vial of 50 mg per ml, which is called as MTX 50, and the other tablet pack is it's called MTX, which contains methotrexate 2.5 mg tablet, and one strip has got 10 tablets, and in you've got 10 strips, so it's a pack of 10 by 10. Okay, so this is how your pack looks like. It has to be stored below 30 degrees Celsius. So I hope this product is clear to everyone. Yes. So it's a very
Yes.
simple thing. MTX is methotrexate. It's an antimetabolite. Can be used for multiple indications like breast cancer, ALL, NHL, non-Hodgkin's lymphoma, Burkitt's lymphoma, trophoblastic tumor. We have seen the different dosages. Some of the other indications which are the non-onco related indications also we have seen psoriasis and rheumatoid arthritis. Okay, depending upon which doctors also you are meeting, you can promote the indications, plus how it has to be stored, what is the concentration. We have seen everything. So if this is clear, then we can proceed further. Yeah.
Mistake on.
Oh, sorry. Yeah. Of course, it can be promoted to medical oncologists who are seeing solid tumors. It can also be promoted to hemato-oncologists because they see leukemias and lymphomas also. It can be
It
promoted to
may
really, yeah.
decrease folate. It may happen
uh,
folate deficiency. Is it right?
It can have, yes, it can have folic acid deficiency. Therefore, folic acid has to be given externally. Folic acid tablets are started before and it has to be given even after taking methotrexate dose. So that has to be given as a supplement. Because the natural folic acid will, of course, deplete. So externally, you have to give. Yeah.
Okay.
Yeah. Now coming to the target audience of MThex, medical oncologist. Why? Can anyone tell me which indications are for medical oncologist here?
Which indication? The medical oncologist. Target audience medical oncologist ነው ተባለ አይደለ? Which
We saw the
indication?
indications, right?
Medical oncologist ምን ምንድን ነው? ሜዲካል ኦንኮሎጂስት ከዘረዘረቻቸው አሉ አይደለ? ኢንዲኬሽንስ ብለን ከእነሱ ውስጥ የትኛው ጋር
Yeah. See, the indications are here. Tell me, medical oncologist will see which indications?
hand and neck,
Come on, the indications are on the screen.
Yeah,
Which
the
indications? Medical
first,
oncologist, breast cancer, correct? Huh. I think we've lost the network.
Yeah.
I think they're reconnecting. She was just handled for 2 minutes. एक मिनट अरुण आया था हाँ. एक मिनट आप जरा देखो मैं फोन करती हूँ. Hello. Oh,
Yes, please tell me.
oh, one second. In my slides, even my slides are not visible.
Yes.
Yeah. Till the time I'm opening the slides, tell me which are the indications which will be prescribed by the medical oncologist, will be seen by the medical oncologist.
okay. The first indication which can be used by the medical is breast cancer
Yes.
and head and neck cancer
Yes.
and trophoblastic tumors
Yes.
and also Burkitt's lymphoma.
It's a lymphoma. Actually, the medical oncologist can see. But what you all told me in Ethiopia, the medical oncologists are not seeing leukemias and lymphomas. They are being seen by the hemato-oncologist.
Yes, yes.
So,
Hemato-oncologists see.
yeah. So then in that case, in Ethiopia, Burkitt's lymphoma is not for medical oncologists. For medical oncologists, you have breast cancer, head and neck cancer, and trophoblastic tumors. Okay. So which are the
Yeah.
indications for hemato-onco?
For the hemato-oncologists, the first acute lymphocytic leukemia, non-Hodgkin's lymphoma, and Burkitt's lymphoma.
Very good, very good. And see, wherever a radiation oncologist is there, and if a radiation oncologist is giving chemotherapy, in case he's giving chemotherapy, then any of the indications can be prescribed by or can be seen by the radiation oncologist also. Okay, only if he's practicing chemotherapy. Right? So that
Yes.
choice I leave to you because that depends upon the market that you're dealing with. Fine. So this product is clear to everyone.
Yes.
Yeah. So we can move to the next one.
Yes, we can.
Okay. Thank you. So next should be I have memo pen. This is correct. My slide is visible.
Yes, it's visible.
Okay. Okay. Now I'm coming to a totally new and a different subject. Basically, these products, Memofen, Mamazole, and Momazole, are purely for treating breast cancer. Okay. So, and we have seen yesterday that breast cancer normally will arise due to the increase of one or the other hormones, either estrogen or HER2 human epidermal growth factor receptor. Okay, so the product that we are going to deal with, mamazole, Omazole, Memofen, are of course for treating breast cancer, but for which type of breast cancer patients? Patients whose estrogen levels are high, so estrogen receptors are very active, right? So basically, this is not a chemotherapy. They are actually hormonal treatments which are given for treating breast cancer patients, right? So I'm going to take all the three together because all the three are interconnected. So once you understand one, you will understand the others also. Now, as we have discussed, breast cancer generally is dependent on one very important receptor, that is estrogen receptor. Almost 70 to 80% of the patients who are seen are ER positive. You can also call ER/PR positive, estrogen and progesterone receptor positive, or even ER positive, because they go hand in hand. So when no estrogen is present, see, breast cancer is a hormonal dependent cancer. So when the estrogen levels are high, and if a patient is suffering from breast cancer which is associated with estrogen, so when the levels are high, the breast cancer cells multiplication will be very, very fast. So if estrogen is high, breast cancer will get its food, so it will get all the food material, so it will keep on multiplying. So our goal has to be to somehow remove the estrogen from the body, right? Either to block the estrogen, or to make it inactive, or not allow the production of estrogen, right? So all these drugs act in one of these ways, and then they can manage breast cancer, right? So we'll see each one of them. When the estrogen receptors are exposed to estrogen, however, they will trigger a chain of events because of which the multiplication of cells will take place. As I told you, estrogen is the main hormone which is responsible for growth and development of breast cancer. 75% of the females will have estrogen receptor, will be estrogen receptor positive in breast cancer patients. Therefore, the main purpose has to be deprive the patient of estrogen. Okay. And till today, if you see, if a patient is ER/PR positive or ER positive, the first line of treatment will be tamoxifen. Okay, the first treatment or the drug of choice today is also tamoxifen. Okay. Now, what does tamoxifen do? It has anti-estrogen activity. What is the activity? It is anti-estrogen activity. How it acts? It will inhibit the estrogen. What it will do? It will go and just inhibit the estrogen which is present in the female's body, and by inhibiting the estrogen, the free estrogen will not be present, because of which the breast cancer cells will not get estrogen, and they will stop multiplying. This is how it controls breast cancer. So this is the simple mode of action of tamoxifen. If you see this diagram, if estrogen is present, ER positive, cancer cells are growing and multiplying, and they are increasing, right? When without estrogen, if you deplete the body of estrogen and the estrogen is inhibited, then the multiplication of these breast cancer cells will be minimized, and you will see only few cells which are remaining. So this is the simple mode of action of tamoxifen. Until today, doctors do prefer using tamoxifen as the first drug of choice because it is comparatively a safe product, right? Now, coming to basically what are the indications of tamoxifen. If you can see here, I have written tamoxifen can be used for premenopausal women and postmenopausal women. Can anyone tell me what is premenopausal and what is postmenopausal? Anyone?
And post.
Yes, who can try?
when we say pre and post menopausal women, when
Yeah.
we say a premenopausal woman, in which the woman can see a menstruation, and when we say a postmenopausal woman, a woman which stops seeing a menstruation.
Yeah. So after the female has undergone menopause, then it becomes postmenopausal woman, and before menopause becomes premenopausal woman. Right? So that is clear. Now, tamoxifen is a drug which can be used for premenopausal women and postmenopausal women and who are ER positive or ERPR positive. That means estrogen receptor positive, right? The advantage of this drug is it can be used pre and postmenopausal conditions both. That's why it is still a drug of choice. Yeah. Now, in pre and postmenopausal cases, also there are some indications where specifically tamoxifen can be used. First is adjuvant treatment of breast cancer, that is for the treatment of node positive breast cancer in postmenopausal women. Now, adjuvant treatment, anyone? What do you mean by adjuvant treatment?
ሌላ ሰው የሚሞክር
Hmm?
አትሞክሩም? ሌሎቻችሁ ሮዛ ብቻ ሆነች እኮ እ?
Fast, fast. What do you mean by adjuvant? Treatment which is given before surgery, after surgery.
After surgery.
Yes. Breast cancer is a solid tumor. Therefore, first prime modality is surgery. So after surgery, the treatment that you're giving, the chemotherapy or the hormonal treatment that you give is adjuvant treatment, right? So tamoxifen can be used for adjuvant cases of breast cancer, but which where it has been node positive. That means one or more nodes were involved. So there, tamoxifen can be given. So in adjuvant treatment, it can be given, but where in adjuvant, where the females had one or two nodes or even more nodes which were positive, in such females, tamoxifen can be given, right? It is also used for ductal carcinoma in situ. That means in women with DCIS following breast surgery and radiation, it is indicated to reduce the risk of invasive breast cancer. Now, what do you mean by ductal carcinoma in situ? Whenever you see a word called in situ, means at the place where it originated. That means cancer where it had originated, so it is in situ. So if it is ductal carcinoma in situ, that means the cancer is still at the place where it had originated. Now, since it is ductal carcinoma, means it had originated in the milk ducts. In the breast, you have the milk ducts which actually carry milk. Okay, so if it originates in the ductal region, it becomes ductal carcinoma in situ. So, uh, the stage which is called as ductal carcinoma in situ, that means the breast cancer is still at the milk duct level and it had originated there. Therefore, it is called as ductal carcinoma in situ. When it goes and progresses, then it becomes invasive ductal carcinoma. Invasive means it will go and spread to the nearby tissues, right? So, actually, breast cancer, when we take up in detail, then of course we explain what is ductal carcinoma, what is invasive ductal carcinoma, and things like that. And there are different types of breast cancers also, but I cannot take that in detail because we are short of time. So I'm just explaining you what is ductal carcinoma in situ. In situ means it is at the place where it originated. And since it is ductal carcinoma means it originated in the milk ducts. So still the cancer is at the place where it originated. There tamoxifen can be given. And why it is given? For treating and also to reduce the risk of invasive breast cancer. Risk of invasive means it is not allowing the carcinoma or the cancer cells to spread to the nearby tissues because now it is in situ. As I told you, when it progresses, it will become invasive. What do you mean by invasive? It will go and spread to the nearby tissues, right? So by giving tamoxifen, you will treat DCIS plus you will not allow the DCIS to progress to the nearby tissues. Okay, so there tamoxifen is given. It can also be given in metastatic breast cancer. What do you mean by metastatic? That means the disease has gone and spread to the other organs. It started in the breast, but it is going and spreading to the lung, or it is going and spreading to the brain. It can be anywhere. So in metastatic breast cancer, also tamoxifen can be reduced. And one more important indication is it is given to reduce for reduction in breast cancer incidence in high risk women. Okay, these are women who have not got any cancer, but the chances that they can get breast cancer are very high. Who are such women? Women who have taken some or the other hormonal therapy, or they are women who are overweight. Okay, because if the female's weight is very high, the chance that the female can get breast cancer also increase, right? Or if the female has had some breast cancer in the family, that means if the female's mother had breast cancer, or if any of her aunts had breast cancer, or if any of her sister had breast cancer, then the chances that this female can get breast cancer are also high. So to reduce breast cancer incidence in high risk women also, tamoxifen can be given. So that is the beauty of this drug. It can be given as adjuvant setting, it can be given in ductal carcinoma in situ, it can be given in metastatic breast cancer patients, and it can also be given in high risk women also. Okay, so these are the four big indications. It can be given in pre-menopausal women, and it can also be given in post-menopausal women who are ERPR positive. So I hope the indications are clear. I
Yes,
hope
it's
it's
clear.
clear. Yeah. Okay.
Yes.
So I'll proceed. Now coming to the dose. The dose of tamoxifen generally is for adjuvant and in metastatic breast cancer is between 20 to 40 milligram daily for 5 years. But what we have observed here in India is generally females are given 20 milligram daily for 5 years. So you'll have to check in Ethiopia, depending upon the body surface area of the females, sometimes even 40 milligram might be given. So that you'll have to see what is the practice. But here, when the body surface area is an average body surface area, then the females are given 20 milligram. And if it is high, then the patients can be given 40 milligram daily for 5 years. Okay. When the dose is greater than 20 mg per day, it should be given in two divided dose. It cannot be given together. If 40 mg has to be given, then 20 mg in the morning, 20 mg at evening. Okay. For ductal carcinoma in situ, the recommended dose is 20 milligram for 5 years. And for reduction in breast cancer incidence in high risk women, 20 mg daily is recommended for 5 years. So if you get a patient who is put on tamoxifen, then generally the patient will continue the therapy for 5 years, unless and until the disease progresses or the patient suffers from some side effects, which is very, very low with tamoxifen. Only then the patients stop. Otherwise, the patients continue minimum for 5 years. There are studies where the patients are continuing the drug for even more than 5 years. Okay, so minimum dose recommended is 5 years. This dose is clear to everyone?
Yes, it's clear.
Okay. So there are some of the partial estrogen agonist effects of tamoxifen. Since it's a hormonal treatment, there are partial estrogen agonist effects, like some of these partial estrogen agonist effects are good because it prevents bone demineralization in postmenopausal women. See, post-menopause, females generally suffer from bone demineralization. What is bone demineralization? Bones are made up of different minerals, especially calcium, magnesium, and such. So after the age of, after the menopause, most of the women suffer from bone demineralization because their minerals reduce. The quantity of the minerals in their bones starts depleting, like calcium, magnesium, they deplete. So what is given after menopause? Always females are given some calcium supplements. That is a general tendency. But the advantage, if the patient is taking, or if the female is taking tamoxifen, the female who is in the postmenopausal stage will not suffer from bone demineralization because it prevents. So that is the advantage. Now, what is the detrimental side of the estrogen agonist effect? These females have a chance or have risk of landing up with endometrial cancer. Okay, so what is endometrial cancer? Endometrial cancer is nothing but cancer seen in the uterus only. Okay, so the risk of getting these cancer is high if the female is given tamoxifen, and that too if the female is given tamoxifen for a longer duration of time. So what has to be done? Frequently checkups are required to see if any endometrial cancer is getting developed or not. So if at all any changes are seen, then immediately the drug can be changed, or a change in the protocol can be done. Okay, so endometrial cancer risks increase if it is given for a prolonged duration of time. Patients can get thromboembolism. Can anyone explain me what is thromboembolism? Anyone? It's a simple terminology used in pharma. What is thromboembolism? Thrombo?
There is an
Hmm?
blockage of the blood vessel by a blood clot.
Yeah, there'll be some blood clots which will be seen, and when these blood clots are moving inside the blood vessels, they can obstruct the circulation of the blood and can clot any of the blood vessels, right? So these type of detrimental side effects can be seen with tamoxifen if prolonged usage is there, but the chances are comparatively very, very less. Okay, and in case a patient develops resistance to tamoxifen, then they have to be shifted to some or the other treatment. So these are some of the partial estrogen agonist effects with tamoxifen. Some of the common side effects, which are generally the side effects associated with hormonal treatments, are could be bone pain, hot flushes, patients or females feel a lot of heat even under the normal temperatures, nausea, fatigue, mood swings because it's a hormonal preparation, depression because it's a hormonal preparation, headache, hair thinning, females hair start thinning, constipation could be, and dry skin also is a very common side effect associated with any type of hormonal preparation for that matter. Other side effect we saw at endometrial cancer could be abnormal vaginal bleeding or discharge sometimes. Thromboembolism we have also seen. Okay, now you have two strains available in Ethopia, 10 milligram and 20 milligram. Both come in similar packing. Each strip has got 10 tablets, and 10 such strips are packed in one mono carton. So one pack is of 10 by 10 tablets. That means 100 tablets in one pack. Okay, so both the packings are the same. So this is about tamoxifen. Basically, it is anti-estrogen in nature. It inhibits estrogen in the breast cancer patients, and it can be used in adjuvant setting, in ductal carcinoma in situ, in metastatic breast cancer patients, for high-risk patients also. The general dose for adjuvant and metastatic disease is 20 to 40 milligrams, and for high-risk patients and for ductal carcinoma in situ, the dose is 20 milligrams, which has to be given daily, and patient continues it for 5 years. So I hope this is clear. Yeah.
Yes. Questions?
Okay.
Okay, one question.
Yeah.
I have a one question, Miss Deputy.
Tell me.
Is there any drug-drug interactions we expect from taking tamoxifen?
No, 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 no. It's comparatively a safe drug, can be used, has got prolonged usage. There is anything else?
ሌላ አለ? I think it's clear.
Okay. So now we proceed to the other part. We saw estrogen is the one which is responsible for 75% of the females who are suffering from breast cancer. So the purpose of any treatment is to either inhibit estrogen or to remove the estrogen from the circulation, right? So we have seen tamoxifen can be given for premenopausal and postmenopausal, but there are aromatase inhibitors like letrozole and anastrozole, which can be given only for postmenopausal women. Okay, as a name you can see here, it can be given for postmenopausal women because in postmenopausal women, though menopause has come, still estrogen levels are seen. Why? Actually, after menopause, females should not be having free estrogen, right? But what happens in the female's body, if you see here in this diagram, see, women who are in the postmenopausal stage, there there is presence of estrogen. How it happens? Because in females where I mean females have got fat, muscles, and adrenal glands. After menopause, what happens? From fat, muscles, and adrenal glands, you have androgens which are present in smaller quantities. Now, these androgens, though they are male hormones, they are present in small quantities even in females. Okay, so when these androgens which are present in the female body, though in smaller concentration, they can get converted, if you see here, to estrogen. But how will they get converted to estrogen? With the help of an enzyme called aromatase enzyme. Okay, so this aromatase enzyme basically is helping the androgens to get converted into estrogen. So with the help of aromatase enzyme, you see estrogen in the female's body, right? Now, if a female is suffering from breast cancer, which is due to estrogen, then our goal is to remove this estrogen. Okay, so what aromatase inhibitors do, they go and attach themselves to this enzyme, this aromatase enzyme. So they will inhibit this aromatase enzyme. If they're inhibiting this aromatase enzyme, then what will happen? It will not convert androgens to estrogen. These androgens will not get converted to estrogen. If they do not convert androgens to estrogen, then obviously free estrogen will not be there in the female's body, because of which the breast cancer cells cannot multiply further. Okay, so the mode of action of aromatase inhibitors, your letrozole or anastrozole, is they will inhibit the enzyme called aromatase enzyme, and because of which the androgens do not get converted to estrogen. That is a simple mode of action of any aromatase inhibitors for that matter, right? So you understood the mode of action. It is very simple. It's an aromatase inhibitor, right? This I've already explained you. Yeah,
Yes, it's clear.
yeah. So now they were we are dealing with, of course, anastrozole and letrozole, but there are three generations of aromatase inhibitors which have already come. First generation molecule was aminoglutamide, then came exemestane, and in the third generation is anastrozole and letrozole. So anastrozole and letrozole is being used very widely today. Exemestane is also there. Aminoglutamide's usage has declined comparatively, right? Because all the other aromatase inhibitors are scoring over aminoglutamide. So I have explained you this. It's an aromatase inhibitor, scores over the others. Yeah, now coming to the indications. We have seen that aromatase inhibitors are, of course, for postmenopausal women only. Postmenopausal women with ER positive, that means who have got estrogen receptor positive. Now, there also where exactly it can be used. It can be used in early breast cancer. What do you mean by early breast cancer? Basically, early means the disease is still localized till the time surgery is possible, stage 1, stage 2 level. It is early breast cancer. So, in early breast cancer, it can be given. But first, surgery is done because the prime modality in early breast cancer is surgery. You resect the tumor, remove the adjacent tissues. If any node is involved, you remove it. And after that, you give adjuvant treatment like tamoxifen, so that if any cells, if any breast cancer cells are remaining, they will be managed and killed with the help of aromatase inhibitors like letrozole or anastrozole. It can also be given for extended adjuvant patients. Now we have seen it can be given for adjuvant patients. Adjuvant patients, of course, after surgery, the treatment that you're giving is adjuvant treatment, and their aromatase inhibitors is approved. Now, what do you mean by extended adjuvant? We have seen in tamoxifen that tamoxifen can be used for pre and of course for post-menopausal women as adjuvant treatment also. So first, the patient is taking tamoxifen for 5 years. But after that, also, if the patient has to continue so that there is no recurrence, there is no relapse, then aromatase inhibitors can be given even after the patient has completed 5 years of therapy with tamoxifen. So that becomes extended adjuvant. Okay. Adjuvant, first the patient takes tamoxifen for 5 years. Okay. If the disease is progressing and you want that there should be no recurrence, you can switch the patient from tamoxifen to letrozole or anastrozole. So that becomes extended adjuvant. And there our letrozole is approved for extended adjuvant treatment of early breast cancer patients who have received prior standard adjuvant tamoxifen therapy. They can be given letrozole. It is also approved in advanced breast cancer patients where first and second line treatment for hormone receptor positive or unknown advanced breast cancer patients. So in advanced breast cancer, it can be given as first line treatment and also as second line treatment, whether the patient is ER positive, or if you don't know it is which receptor which is actually responsible for breast cancer, there also patient can be given letrozole. So in advanced breast cancer cases as first line and second line, for patients who have who where we know it is ER positive, or sometimes you cannot make out whether the patient is ER positive or HER2 positive or any other receptor positive. If you cannot make out, in those conditions also patient can be given aromatase inhibitors like letrozole or anastrozole. Okay, so these are the three indications where letrozole is approved: early breast cancer, in extended adjuvant, and in advanced breast cancer cases also. The dose is very simple, 2.5 milligram once daily. It's a flat dose, 2.5 milligram once a day. Patients generally continue it for 2 years, 5 years. There are data where patients have continued letrozole for beyond 5 years also. No dosage adjustment is required for patients with mild to moderate hepatic impairment. Your pack is like this. This is a pack where letrozole tablets are of 2.5 milligram. One strip has got 10 tablets, and 3 such strips are packed in one monocarton. Can anyone tell me why only 3 strips are packed in a monocarton? Yeah. Why 3 strips are packed in one monocarton? Yeah, fast, fast, fast.
We don't have any idea, Mr. Can I
My
explain
God, my God, my God. What did I tell you? 2.5 milligram has to be given daily. So there are
this?
how
Yes,
many days in a month?
30 days.
30 days. So how many tablets do you require in a month?
30 tablets in which we call 3 strips.
Yes. So we have got 30 tablets at one monocarton, right? So one carton is sufficient for a female for 1 month, right?
Yes.
That's why the pack is designed in such a way that 30 tablets will come in one monocarton. So easily the patient can purchase 1 month's therapy. So it's clear now?
Yes, it's clear.
Okay, so we proceed. Now coming to vomazole. Vomazole is also Yes? Any confusion? I can see some disturbance there.
No, we were just discussing about the packaging, but there's no any
Okay,
question. We can proceed.
okay. So we just saw letrozole. I will not repeat the mode of action because letrozole and humazole have got the same mode of action. Now we straight come to the indications. Humazole is of course for postmenopausal women who are ER positive. Just sorry, one second. Hello. Acha, see, you all will require a break for lunch, right? Kimia?
Hello, Mr.
You will be requiring a break for lunch now? I can continue,
Yes.
no?
How many products are you to discuss with us?
No, I have multiple products. What time will you like to break for lunch? Tell me, or you all have already done your lunch?
Now it's our lunch time, so can you give us a little bit break?
Yeah. So wait, I'll just finish this product in 5 minutes and then give you a break, right?
Okay, yeah, we can
5 minutes.
continue this one.
5 minutes.
Okay.
5 minutes, right? Yeah. So fine, Vomazole, we know the mode of action. The indication is, again, it can be used for early breast cancer. That means in adjuvant treatment, where in adjuvant treatment means patient is in the early breast cancer stage, patient has undergone surgery. So immediately after surgery, patients can be put on anesthesia. Okay. Locally advanced or metastatic breast cancer, that means the disease has spread locally to the nearby tissue or it has metastasized. There also anesthesia can be given. First line treatment for hormone receptor positive or hormone receptor unknown, locally advanced or metastatic breast cancer. Like letrozole, even anastrozole can be given as first line treatment for hormone receptor positive cases and also for hormone receptor unknown cases. That means you don't know which receptors are actually the cause of breast cancer. So there also anastrozole is approved. It is also approved for advanced breast cancer. That means the disease has spread to the nearby tissues. Treatment of advanced breast cancer with disease progression following tamoxifen therapy. So the patients who have already taken tamoxifen therapy, still the disease is progressing, those patients can also be switched to anastrozole. Okay, so basically in early breast cancer also it is approved. It is approved for locally advanced and metastatic breast cancer cases, for hormone receptor positive and also for hormone receptor unknown cases, and also it is approved in advanced breast cancer where the patient's disease is progressing in spite of tamoxifen therapy, right? Which are the adverse reactions? They are nearly the same like your letrozole, except like small indications like asthenia can be seen, which is weakness or patient's energy levels become very low. Arthralgia, there is pain in the muscles, and hypercholesteremia is added adverse effect where the cholesterol's level go high. Okay, so nearly the side effects or the adverse effects are the same like letrozole. So your pack is one strip has got 10 tablets, and in one monocarton you have 10 tablets. I don't know why your packing is such. You just have one strip in one monocarton. You can also have 3 strips in one monocarton, but that might be the requirement there. But patients will generally take 3 strips of Vomazole to complete 1 month therapy, right? So this is about Memofin, Mamazole, and Vomazole. They are all for breast cancer patients, all for ERPR positive cases. Memofin is for post and pre-menopausal women, and Mamazole and Vomazole is for only post-menopausal women. Okay. Oh, sorry, I didn't tell you the dose. The dose of Vomazole is 1 mg per day. Letrozole's dose is 2.5 mg per day. Vomazole's dose is 1 mg per day. Okay, and that has to be continued for 2 years, 5 years. There are patients who have taken the treatment beyond 5 years also, and they are doing good. Yeah. So that's it about all the 3 drugs. So you want to break now?
Yes.
It's exactly 4 o'clock, but I have a request, Kimia. We will sharp meet after 30 minutes. Huh?
Lunchtime हो गया.
It's a lunchtime, Miss Dipti. Can you make it a 40 minutes, please?
1 hour, because we have multiple products remaining. Today try to finish within 45 minutes at least.
Okay, okay.
Okay. So 45 minutes.
45 minutes, okay.
I think it's 4, 5 here. We'll meet exactly after 45 minutes, right?
Okay, yes.
Okay. Thank you. Thank you. But Kimia, just ensure that everyone reaches after 45 minutes. Yeah, please.
Sorry, I was outside, but sorry.
Oh,
So
I wanted
yeah.
to give a break of only 30 minutes, but they're asking for
Oh.
45 minutes, 1 hour actually.
All right. So
Can you
let
make
us
it up in 30 minutes? Is it possible?
not same as yesterday. So I
45
will try
minutes,
to be
45 minutes.
better.
Okay,
thank
exactly
you.
after 45 minutes, yeah?
Sure.
Okay,
Thank you.
okay, okay, okay.